Good morning.
Yeah, good morning, all. Good to be with you.
All right, we heard from the president last night where he talked about some of the initiatives, including, for the most part, cutting off all travel from Europe, with the exception of England and Ireland, I think, things like that. What has been the reaction to the White House over the president's move last night?
Well, I think the reaction has been very favorable across the country. I mean, the American people have seen once again that President Trump has no higher priority than the health and safety of the people of this country. You go back to when the coronavirus first emerged in January in this country, the president, again, just like he did last night, he took unprecedented action in January to suspend all travel from China. We quarantined any Americans that were returning from China to put the health of America first. We issued travel advisories for Italy and for South Korea. But now the reality is that the epicenter of the coronavirus epidemic has moved from China and South Korea to Europe. Our task force has been tracking that. We brought that information to the president in real time. And yesterday he made the decision in the Oval Office to suspend all travel from Europe for the next 30 days. And to be clear, Steve, every American that is returning from Europe will be screened as they return through 13 separate airports and will be asked to self-quarantine for 14 days. It's part of the president's strategy. We want to prevent the coronavirus from being brought into the country and then continue to focus on those communities where we have community spread, even as we encourage best practices and common sense by every American.
Mr. Vice President, what do you say to those families that have kids in college that are traveling abroad, studying abroad? I know maybe if they're in Italy, they either have to stay put at this point, or are they able to come home? What about kids that are in Switzerland and in Ireland and France?
Ainsley, it's a great question, and I've had kids that have studied abroad as well. Every one of those families should know that their children can come home. They will be funneled, as we say, through a series of 13 different airports, and then we'll ask them to self-quarantine regardless of their symptoms or what their condition might be.
Should they come home or could they stay?
Well, look, I would suggest to you that now that we see that that 70% of the new coronavirus cases in this country or in the world are now being manifest in Europe. I'd leave that decision to every family, but there's no barrier to their kids or any American coming home. They'll go through a process. We'll ask them to self-quarantine, but they can all come home.
So, Mr. Vice President, 62,000 Chinese citizens have been discharged from the hospital. They know if we're to believe them, they only had 15 cases the other day, 8 of which were from Chinese citizens, 6 came from the outside. If success leaves clues, and that massive quarantine of entire cities has got the number down that low, do you think we should we do the same thing as China did? After all, they started the whole thing, and they seem to be on top of this now.
Well, we're seeing some encouraging news from Asia, and the president last night in his address to the nation said that we may be able to reconsider our current posture with regard to China and South Korea as a result. But make no mistake about it, Brian, our focus here, in addition to preventing the coronavirus from being brought in, and what we learned from our health experts in the last 36 hours was that yesterday, as of the 35 cases where we had coronavirus cases, about 30 of those states, 35 states, 30 of those states actually could trace the contact to someone in Europe. That's the reason the president took the decisive action he took. But make no mistake about it, we are also focusing on supporting efforts at the state and local level in California, in Washington State, and in California. CDC issued very strong guidelines for those communities about public activities, large gatherings, schools, and we'll continue simply to follow the data on this and make strong recommendations where we have what's known as community spread. But for every American right now, as the president said last night, it's a good time to use common sense, wash your hands often, clean, often used surfaces. All that information is available at coronavirus.gov. So we're going to try and mitigate the spread in this country, but also prevent, through the president's decisive action last night, people from bringing coronavirus into the United States any further from Europe.
Right. So just to clarify, you're not going to do what they did in Wuhan. You're not going to say Manhattan, you're locked down. Sacramento, you're locked down. You're not going to do that as of now, even though they did that in China.
Well, what I promise you, Brian, is that we're going to work very closely with state and local officials to give them the very best counsel from CDC and our healthcare experts. I talked to the mayor of New Rochelle yesterday. I know they've established a zone in their community for extra countermeasures against coronavirus. I talked to the governor of New York, Washington State, and California yesterday about new specific guidelines for their communities. But I want to say to your viewers, just as the president said last night, the risk to the average American of contracting the coronavirus remains low. But we do know that seniors with serious underlying chronic health conditions are particularly vulnerable to very serious outcomes. And so we're encouraging best practices for every American. We're focusing on communities where we have community spread.
Right.
But for any American that's watching today that has a family member, a loved one who's a senior citizen with a serious underlying health condition, this is a very good time to help and to support them, to be able to avoid public places, and everyone around them to engage in good hygiene and good practices to protect those that are most vulnerable.
And the key is what is now referred to, Mr. Vice President, as social distancing, where you just keep a distance from people around you. If you've got to go to the grocery store, don't come up right behind them. You just never know who might have it. I know the president has called off his domestic travel. He's postponed a rally and a fundraising event. We know that the NBA has suspended their season. The NCAA is going to do March Madness without people in the stands for the most part. And then you've got Anthony Fauci yesterday who said, it's probably going to get worse before it gets better. And there's a story out as well that says that last week Republicans in Congress were told there's a good chance that most people in the United States will be exposed to it. Doesn't mean they're going to get it, but it could be out there.
Right. Well, look, one of the things that we know about the coronavirus from our experts studying global data is it's 2 to 3 times more contagious as a respiratory illness. And so we'll have thousands of more cases across this country. But your viewers deserve to know that most Americans, the vast majority of Americans who even contract the coronavirus, will have flu-like symptoms and will fully recover. I talked to a man named Clay Bentley in Rome, Georgia yesterday on the phone. He's doing well. He's recovering well. And his personal strength and his faith have sustained him through this, and it was inspiring to talk to him.
Right.
So we don't want, as the president's conveyed, we don't want Americans to be overly concerned. We want everybody to practice good common sense.
Sure.
But in those communities where we have community spread, we're going to continue to give very aggressive recommendations, as we have in California, in Washington, and New York, to do exactly what you're saying with regard to social distancing. And we'll respect the decisions of any business, any sports enterprise that decides to cancel events to put the health of the country first. But it's really important, I really believe, to focus on the most vulnerable, seniors with serious underlying health conditions. It's the reason why we're focusing more inspections. We've raised the guidelines at nursing homes, and we're recommending that people other than those that have family members in hospice care, special circumstances, avoid visiting nursing homes over the next 30 days.
I love that a lot of these businesses are making smart decisions. I know the financial market, many of the banks here are saying you can work from home, you can travel to see your family and stay there and just keep your phone close by and work using your computer. What about the masks? I mean, excuse me, not the masks, the tests. Because if you feel like you have those symptoms and you call your doctor, before you show up, right? Is that what we're supposed to do? Call in advance so you don't just walk in and infect
Yes.
other people? Do we have enough tests out there?
Ainsley, we are working every single day to clear out any red tape to make tests more and more available. Right now, every state lab in America can conduct testing. Any one of your viewers that may have a concern can call their doctor. Their doctor can contact the state lab and determine how to get a test processed. I'm also proud of the fact that university hospitals and around the country are conducting tests. The University of Washington is doing a significant number of testing right now for their citizens that have been impacted by the coronavirus. But lastly, the president, he said this was a whole of government approach, but he also said this is a whole of America approach. So he's brought in business leaders from nursing homes, yesterday banking, hospitals, and the rest. But one of the things we did that's most important on testing was the president brought in the leaders of the top commercial laboratories in the country who, as we speak, have already approved a test that is being spun up, it's being sent out to market. Quest, LabCorp, the largest commercial laboratories in the country are working very closely with our administration. We're clearing the red tape out of the way. That's going to be the way that in the days ahead, we're going to have broad-based testing available all across the country.
Right, and just in terms of the numbers that we woke up with, worldwide, 118,000 cases, U.S. confirmed 1,110 deaths, 36, 40 states affected, including Washington, D.C. Do you have anything to expand on that?
No, those are the numbers. I haven't gotten my full briefing yet this morning, but those the numbers that we really focused on in the president's decision yesterday, though, Brian, was the fact that 2 weeks ago, Italy had roughly 500 cases. As of yesterday, they have 12,000 cases. Germany was at another 1,000. Right. France was at another 1,000. That's why the president recognized that the epicenter of the coronavirus has shifted from China and South Korea to Europe. And that's why he took the unprecedented step, the same thing he'd done with China, to suspend all travel for 30 days from Europe. It's about preventing the additional flow of the infection from Europe into our country. But make no mistake about it, we're also at the same time focusing on mitigation strategies in communities where we have community spread. We're encouraging best practices for every American, especially for our most vulnerable population. And make no mistake about it, our goal as the coronavirus spreads in this country, and the vast majority who would contract it will have flu-like symptoms and recover, our goal nonetheless is to hold down that overall number as much as possible, and we will do that with the continuing cooperation of American families, schools, businesses, and states. And that's the vision President Trump has. All of us working together will get through this.
Well, these certainly are challenging times, and it's good to know that the president and the federal government have a plan. Mr. Vice President, thank you very much. We know you are
Thank you so
a very
much.
busy man these days.
Thank you all.
Thank you. God bless you.